All right, let's take a look at some of these large arteries as we leave the heart and go down towards one of our toes. Wouldn't matter which toe it is, you're going to see the same. Now, if we leave the heart, remember, when you come out of that left ventricle of the heart, you're going to go into the aorta. There's several sections to the aorta. There's an ascending section, there's an aortic arch, and there's a descending, and that's what we want to take a look at right here. So there's a good little highlighted view of our descending aorta. It travels through the thoracic and abdominal cavity, so it has thoracic and abdominal sections to it. So we watch blood, and we can see the arterial blood in red right here. Arterial is always shown in red and venous in blue. We leave the heart. We go through the aorta. Now once you get down around L2, that aorta is going to split. And it's going to split into common iliacs. So you can see there's a left and right common iliac. Now you follow the common iliac down, it's not going to go very far and it's going to split. And it's going to split into internal and external iliac. Now the internal iliacs go into the pelvic cavity, not the toes. So we're not really worried about those for this continuation right here. But the external iliacs do continue down towards the lower limbs. So again, we started at the aorta, then we went down to a common iliac, and now we're down to an external iliac. So if we follow this external iliac on down, as soon as it gets into your lower limb or femoral region, which is that more proximal region of it, it's going to split. And there you can see how we've got femoral and deep femoral. So again, that was aorta, common iliac, external iliac, femoral and deep femoral. So there are those two through the femoral region as you would expect. Now it's going to run behind your knee and it's going to become the popliteal artery. Now remember, the popliteal region is the region behind your knee. So that's exactly what you would expect it to be named. It's well protected to the back, and of course you wouldn't want it to the front, or every time you bent your knee you'd pinch that thing off. Wouldn't do you any good right there. So popliteal artery to the back behind your knee. Now you get down further, you get into the leg or crural region. Now remember, there's two bones down there. There's the large tibia, which is medial to the inside, and then the fibula, which is smaller and lateral to the outside. So the tibia has got two arteries associated with it. There's an anterior and a posterior tibial artery. Anterior is going to be to the front, and the posterior is going to be to the back. There it is right up there at the top. So there are our two medial. Remember, that big bone is medial to the inside, so these are medial to the inside, and one runs in front and one behind that bone. Now remember, the fibula is the smaller bone to the outside. So lateral, there is a fibular artery. Follow these on down, you're going to get down into that ankle region. Lots of bones in this area down here, and lots of little arteries and veins associated with them. Here's a tarsal artery right here. Here's a calcaneal. Remember that calcaneus is to the back right there. And the tarsals are these small bones in your ankle. There's the dorsalis pedis, dorsal to the back, pedis meaning foot, right there. Here's some of the little tibial arteries we saw before. There's an artery of the foot right here, the arcuate artery, the plantar arch artery, and so on down the line until we eventually get into these digital down in the toes. So again, if we go back to the top, that was the aorta. Splits at L2 in the common iliac, external iliac, femoral and deep femoral. Then you got popliteal behind your knee, the two tibial, anterior, posterior, fibular, which is lateral to the outside right there. Then you get all these done in your ankle, and then of course you eventually get down into the toes. And again, it would not matter which toe you went to, it's going to be the same in either direction. Most of the time what we see on one side of the body, we do have on the other. So there's that aorta. There's a common iliac. There's an external iliac. We move our picture right here. There's that femoral. Come to click. And that deep femoral right there. Down a little bit lower, we've got that popliteal back behind your knee right there. The two tibial. Again, there's an anterior and a posterior, one in front and behind that tibia. And then again, lateral to the outside, the fibular. And then, of course, all the way down through these smaller ones to the digital and the toes. So nice little continuation there. We will look at more of these soon.